It is a daily ritual for millions of men. Often shrouded in privacy, the act of self-gratification, or simply ejaculation, is frequently dismissed as just a release of tension or a moment of pleasure. But for urologists and men's health experts, this habit acts as something far more critical. It is a biological dashboard. Every time this function occurs, your body is sending a direct status report on the health of your most vital reproductive gland, the prostate. There is a massive amount of confusion surrounding this topic. You have likely seen the headlines. Some claim that doing it too frequently depletes your energy and nutrients. Others cite studies suggesting that frequent release is the ultimate shield against cancer. But amidst this noise, most men are missing the most immediate signal. The warning you saw before clicking this video suggests you should pause before you engage in that habit again, and here is why. The sensations, the consistency, and the aftermath of that act are the earliest warning system you have. If you do not know what to look for, you might be ignoring the early whispers of inflammation, enlargement, or potentially worse conditions. By the end of this video, we will cut through the myths. You will understand exactly what the Goldilocks zone of frequency really is according to medical data, and most importantly, you will learn to recognize the number one warning sign that the prostate gives during this private moment, a sign that requires your immediate attention. To understand why your daily routine can become a danger signal, we first need to look under the hood. The prostate is often described in simple terms as a walnut-sized gland, but that comparison undermines its complexity. Think of it as the central mixing valve of the male reproductive system. Located deep in the pelvis, it sits directly below the bladder and in front of the rectum, wrapping completely around the urethra, the tube that carries urine and semen out of the body. Its primary function is the production of seminal fluid. While the testicles produce the sperm, it is the prostate that generates the milky fluid that nourishes and protects that sperm, giving it the volume and chemical balance necessary for survival. This means that every time ejaculation occurs, the prostate is doing the heavy lifting. It must contract vigorously to expel this fluid into the urethra. It is not a passive participant. It is the engine of the event. Because of this strategic location, the prostate occupies biologically expensive real estate. Even a minor change in its size or internal pressure has immediate consequences. If the gland swells due to inflammation or benign growth, it acts like a clamp on a garden hose, restricting urinary flow. But beyond urination, because the prostate is so rich in nerve endings and muscular tissue designed for those powerful contractions, any dysfunction here often manifests specifically during sexual release. It is an organ highly sensitive to hormonal fluctuations, specifically testosterone and its potent derivative, DHT. It acts as a filter and a fortress, but it is also prone to congestion. When we discuss prostate risks, we are essentially talking about the mechanics of this specific gland. Understanding that this organ physically changes shape, texture, and sensitivity based on your lifestyle and habits is the key to interpreting the signals it sends you. This brings us to the most controversial aspect of men's health, the frequency debate. Is the prostate an organ that follows the use it or lose it principle, or is it a battery that eventually runs out of energy? For years, locker room wisdom and internet forums have argued both sides. However, when we look strictly at the data, a compelling picture emerges, but it is not as simple as more is better. The cornerstone of the argument for frequent ejaculation comes from a landmark study conducted by the Harvard T.H. Chan School of Public Health. This massive piece of research followed nearly 32,000 men over the course of 18 years. The results sent shockwaves through the medical community. The data suggested that men who ejaculated at least 21 times a month had a roughly 20% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times a month. The leading theory behind this benefit is known as the prostate stagnation hypothesis. The idea is relatively mechanical. Semen contains various chemical compounds, some of which can become inflammatory or carcinogenic if allowed to sit inside the prostatic ducts for too long. Regular clearance prevents the accumulation of these potential toxins and specifically crystalloids, microscopic stones that can form within the prostate and cause inflammation. In this view, The habit acts as a flushing mechanism, keeping the pipes clean and the cellular environment healthy. However, blindly chasing that number can lead to the opposite end of the spectrum, creating risks that are often overlooked. Urologists frequently treat patients who, in an attempt to optimize their health or due to compulsive behaviors, push their bodies into a state of exhaustion. This is where the Goldilocks zone becomes critical. While the prostate itself is resilient, the support structures around it are not invincible. Excessive frequency, ejaculating multiple times daily, every day, can lead to a condition known as pelvic floor hypertonicity. The muscles that control ejaculation are the same ones that support the bladder and bowel. If these muscles are overworked without adequate recovery, they become chronically tight and spastic. This mimics the symptoms of prostatitis, infection of the prostate, even when no infection is present. Men in this category often experience pain in the perineum, difficulty starting urination, and a sensation of incomplete emptying. Furthermore, there is a difference between healthy circulation and mechanical irritation. Just as rubbing your skin too frequently causes a friction burn, overstimulating the nerves and tissues of the reproductive tract can lead to sensitization and temporary inflammation. The urethra and the verumontanum, the trigger point for ejaculation inside the prostate, can become swollen and tender. Therefore, the medical consensus is shifting toward a balanced view. High frequency appears protective against cancer in the long term, particularly for men in their 40s and 50s. But this protection is nullified if the habit becomes a source of physical trauma or chronic pelvic stress. The goal is consistency without compulsion. You must distinguish between a healthy biological urge that relieves pressure and a forced habit that masks other anxieties. If the act leaves you feeling drained, in pain, or physically uncomfortable in the pelvic region, your body is telling you that you have crossed the line from maintenance to damage. Now we arrive at the most critical component of this discussion. We established that the prostate is the engine of ejaculation, and we explored the debate on frequency. But the reason you were urged to watch this before engaging in your daily habit again is to identify the specific biological feedback loop that occurs during the act. The number one warning sign that your prostate is in distress is not a vague ache in your back or a frequent need to urinate at night, although those are relevant. The most immediate, specific red flag is painful ejaculation, medically known as dysargasmia. Under normal physiological conditions, the release of tension should be accompanied by pleasure and relief. However, if this moment turns into discomfort, a burning sensation, or a sharp pain radiating through the perineum, the testicles, or the tip of the urethra, your body is screaming that the prostate is compromised. This pain signals that the muscular contractions required to expel fluid are squeezing against tissue that is inflamed, swollen, or infected. Imagine trying to flex a muscle that has a deep bruise or a tear. The movement itself becomes the source of agony. This symptom is the hallmark of prostatitis, inflammation of the prostate gland. It is statistically the most common urological issue in men under 50. When the gland is inflamed, the ducts are narrowed and the tissue is hypersensitive. The pressure buildup during the climax forces fluid through these inflamed passageways, resulting in that searing pain. If you experience this, continuing your daily habit without addressing the root cause is akin to running on a broken ankle. You are aggravating an injury that requires rest and treatment. Beyond the sensation of pain, there is a visual warning sign that causes immediate panic in almost every man who sees it: hematospermia, or blood in the semen. While terrifying to witness, turning the fluid pink, red, or brownish, it is vital to understand the context. In younger men, this is often benign, caused by a popped blood vessel from vigorous activity or minor inflammation. However, this is a direct check engine light. If this symptom persists for more than a few weeks, or if it appears in men over the age of 40, the medical urgency escalates significantly. It can be an early indicator of prostate cancer, severe infection, or strictures in the urethra. It transforms the daily habit from a routine act into a mandatory diagnostic event. There is a third, more subtle warning sign inextricably linked to this process: the sudden onset of erectile dysfunction, ED, paired with urinary symptoms. The nerves responsible for erections wrap around the surface of the prostate like a web. If the prostate is swollen due to benign prostatic hyperplasia, BPH, or a tumor, it can physically compress these nerves or interfere with the blood flow necessary for function. Furthermore, the vascular system of the penis is microscopic. If plaque buildup or endothelial dysfunction is affecting your ability to perform, it is often a systemic warning that the blood flow to the prostate and the heart is also restricted. And speaking of restricted blood flow, this is where many men make a critical mistake. They rely on temporary pills that only mask the symptom, leaving the root cause, that clogged plumbing, untouched. However, there is a bizarrely simple 7-second daily ritual involving a specific natural purple tonic that is changing everything. It targets that hidden root cause, effectively unclogging the hose to restore rock-hard, long-lasting erections and youthful stamina without dangerous side effects. If you want to see exactly how this works and the 76-year-old man who used it to save his marriage, point your phone's camera at the QR code on your screen right now. It will take you to a short video that explains the science behind this remedy. I have also pinned the link in the top comment below for you. Do not ignore your vascular health. Now, getting back to the warning signs, pay close attention to the volume and consistency of the fluid as well. Pay close attention to the volume and consistency of the fluid as well. A sudden, drastic reduction in the amount of fluid released, known as dry ejaculation or retrograde ejaculation, indicates that the bladder neck is not closing properly, often a side effect of alpha blocker medications or prostate surgery, but sometimes a sign of nerve damage, neuropathy, particularly in diabetics. Conversely, fluid that is consistently yellow or foul-smelling is a primary indicator of a bacterial infection that requires antibiotics, not just more flushing out. These signs, pain, blood, sudden dysfunction, and volume changes, are the language of the prostate. They are not normal variations of the daily habit. They are warnings. Ignoring them under the guise of toughing it out or hoping they disappear is a gamble with your fertility and your long-term health. If the act that is supposed to bring relief brings pain or visual alarm instead, the dashboard is lit up, and it is time to look under the hood professionally. While we have discussed the dangers of ignoring warning signs and the potential benefits of frequency, we must address the elephant in the room. In recent years, a massive cultural wave has emerged online, promoting practices known as semen retention, nofap, or dopamine fasting. The central premise of these movements often claims that by completely abstaining from this daily habit, men can unlock superpowers, dramatically increase their testosterone, and reabsorb nutrients into their bodies. From a strict urological and endocrinological perspective, it is time to separate the psychological placebo from the physiological reality. Let's look at the hormonal claim first. The idea that holding on to semen creates a compounding interest of testosterone is largely a myth based on a misunderstanding of a specific study. Research published in 2003 did show that testosterone levels peaked, reaching 145% of baseline on the 7th day of abstinence. However, what proponents of retention often fail to mention is what happened on day 8. The levels did not continue to rise, they dropped back down to baseline. The body has a strict homeostatic feedback loop. It does not stockpile hormones indefinitely simply because you stop ejaculating. While abstinence can help reset androgen receptors and improve sensitivity to dopamine, it does not turn a man into a hormonal giant biologically. From the perspective of prostate health, strict, long-term retention can actually invite the very problems men are trying to avoid. We must return to the anatomy. The prostate is a secretory gland. It produces fluid continuously, not just when you are aroused. If this fluid is never released, it does not simply get reabsorbed efficiently into the bloodstream like recycled water. It accumulates. This leads to a condition known colloquially as blue balls, but medically termed epididymal hypertension or prostatic congestion. When the seminal vesicles and the prostate are engorged with fluid for extended periods without release, the internal pressure rises. This can lead to a deep, aching pain in the pelvis and testicles. Over time, this stagnation can create a fertile breeding ground for inflammation. Just as stagnant water in a pond becomes murky, stagnant fluid in the prostate can become a host for bacterial growth or lead to the formation of prostatic calculi, tiny stones that block the ducts. In fact, the body has a built-in fail-safe for this exact scenario: nocturnal emissions or wet dreams. If a man consciously stops his daily habit for a prolonged period, the body will often force a release during sleep. This is biological proof that the reproductive system is designed for flow, not for permanent storage. However, there is a valid medical argument hidden within these trends. The benefit of these retention practices often comes not from the physical act of holding it in, but from breaking the cycle of compulsive, high-speed gratification often associated with internet pornography. The death grip syndrome, where a man desensitizes his penis through excessive, tight friction, is a real urological issue that leads to erectile dysfunction with a partner. By taking a break, the nerves regain sensitivity and the brain's dopamine reward system resets. So, the medical verdict is one of nuance. Semen retention is not a magic pill for health, and practiced too rigidly, it can lead to congestive symptoms that mimic prostatitis. Conversely, compulsive overstimulation can exhaust the pelvic floor. The prostate thrives on regularity, not extremes. It requires a rhythm that keeps fluids moving without inducing trauma. If you are practicing retention and feel pelvic heaviness or aching, your body is signaling that the storage tank is overpressurized. Listen to that signal. We have covered the warning signs and debunked the myths. Now, we must shift from identifying problems to implementing solutions. You do not need a prescription to start protecting your prostate today. You simply need to adjust your input and your mechanics. There is a protection protocol supported by urological data that focuses on 3 pillars: fuel, flow, and physics. Let's start with fuel. The prostate is unique in its nutritional demands. It accumulates higher concentrations of zinc than almost any other soft tissue in the body. Zinc is the fundamental mineral required for DNA integrity in prostate cells and for fighting off infection. If you are deficient in zinc, the prostate's defense system is down. Including pumpkin seeds, which are naturally rich in zinc, into your daily diet is one of the easiest proactive steps you can take. But the heavy hitter in prostate defense is lycopene. This is a powerful antioxidant found in red fruits, but specifically in tomatoes. Here is the critical detail that most people miss. Eating raw tomatoes provides very little benefit because the lycopene is locked inside the plant's cell walls. To unlock it, you must apply heat. Cooked tomatoes, found in sauces, pastes, or roasted dishes, allow the body to absorb lycopene efficiently. Studies have consistently shown that men with higher dietary intake of lycopene have reduced risks of aggressive prostate cancer. Pair this with green tea, which contains catechins that reduce inflammation and regulate cell growth, and you have a dietary shield working for you around the clock. The second pillar is physics, specifically regarding how you sit. We are living in an epidemic of sedentary lifestyles. When you sit for 8 to 10 hours a day, you are placing the entire weight of your upper body directly onto the perineum, the area between the scrotum and the anus. This compresses the prostate and the nerves surrounding it, reducing blood flow and increasing congestion. If you have a desk job, you must stand up every hour to allow blood to reperfuse the pelvic basin. If you are a cyclist, the warning is even more urgent. Traditional bicycle seats can cut off blood flow to the prostate entirely. Investing in a perineal release seat, one with a gap in the middle, is not a luxury. It is a medical necessity for frequent riders. The third pillar involves the muscles themselves. You have likely heard of Kegel exercises, squeezing the pelvic floor to improve strength. However, for many men experiencing the pain or warning signs we discussed earlier, Kegels are actually the wrong thing to do. If you are suffering from pelvic pain or urinary frequency, your pelvic floor is likely already too tight, not too weak. Doing Kegels on a tight muscle is like doing bicep curls with a cramp. Instead, you need to learn reverse Kegels. This involves consciously relaxing the pelvic floor as if you are gently pushing out to urinate, dropping the muscles down to release tension. This simple relaxation technique can alleviate the pressure that mimics prostate infection. Finally, we must address screening. There is a dangerous misconception that you do not need to worry about prostate exams until you are 50. If you are African American, or if you have a father or brother who had prostate cancer, your risk is significantly higher, and screening should start at 40 or 45. This involves a PSA blood test, prostate-specific antigen. It is a simple blood draw. Knowing your baseline number when you are young and healthy gives doctors a comparison point for the future. Do not wait for symptoms to become unbearable. If your daily habit is showing you the warning signs we discussed, pain, blood, or dysfunction, get the test done regardless of your age. In the end, the takeaway is clear. Your daily habit is not the enemy, but pain or sudden changes during that habit are the messenger. We have established that the prostate is a biological dashboard for your overall health. Whether you align with the high-frequency data for cancer prevention or prefer a more moderated approach to preserve energy, the rule remains the same. Functionality should never come at the cost of pain. If your body is flashing a warning light, be it through discomfort, discoloration, or dysfunction, do not tape over the dashboard. These symptoms are invitations to intervene while the problem is manageable. Men's health issues, including prostate cancer, have incredibly high survival rates when detected early. Silence, embarrassment, and ignorance are the only real killers here. If this breakdown provided you with clarity and cut through the noise of internet myths, make sure to subscribe and turn on notifications. There is much more evidence-based deep diving to do in the world of men's health. Listen to your body, prioritize your longevity, and never ignore the signals.